right. Well, good afternoon. Give everybody a couple minutes to come in, and we have a really good webinar. As you notice, today is Friday, so at NMQ, I like to edutain, as I say, on Fridays. And this week's panel is on HIV testing as ministry, a call to serve, a call to know. I think you should be familiar with, if not everyone, most folks on this panel, as they've educated us around these issues before. We have folks that work in our a former 40 under 40 physician, someone that works in the church community, and we have our very own Chinny that's going to lead us today's webinar. Just for some housekeeping things, as most of you may know, if you have any questions for the panelists, please just place it in the Q&A box. If you want to keep the conversation going with your own stats and figures and just educate the audience, please put it in the other place, in the other box. But without further ado, I'll let you go speak to or listen to people that have much more knowledge in this space than I do, and I'll turn it over to you, Chinny.
Thank you so much, Brandon. Thank you. Good afternoon, everyone. Thank you so much for joining us. It's a very special day. Today is National HIV Testing Day. Yay! Do you know your status? Do you know your status? We hope that by the time we finish our conversation today, you'll be inspired to go find out what yours is, and that you'll learn a few things that you can educate your communities on. You can take some action steps that you can take personally, and that you can advocate for people that you love who may be living with HIV. So without further ado, I'm going to let my esteemed panel introduce themselves. I have, like Brandon said, very esteemed, knowledgeable people about this topic. And so I'll start with Dr. Monica, and then Ms. Vivian will go, and of course, the lovely Ms. Stacy will go next.
Great. Thank you so much, Brandon and Chinny. Good afternoon, everybody. I'm Dr. Monica Hahn. I'm a clinical professor and family and community medicine doctor at UCSF with a specialty area in HIV care and perinatal HIV care. So that means I take care of families and people with HIV in and around pregnancy, as well as family members affected by HIV. And since I'm a family doctor, I practice family-centered HIV primary care, and I take care of patients ranging really from newborn babies all the way to elders. And my work is based at San Francisco General Hospital, where I'm medical director of our perinatal HIV clinic called Hive Clinic. And I'm also involved in medical education and in HIV and public health training and capacity building. And I'm just truly honored to be invited to this space with each of you, and just so inspired by the work that the Faith Health Alliance is doing, and grateful to continually learn from Chinny, Ms. Vivian, Ms. Stacy, and everyone else I've had the pleasure of working with at NMQF. So yeah, honored to be here. Thank you.
Thank you so much. Very humble. Thank you. Thank you. Ms. Vivian?
Oh, good morning. Well, afternoon now, everyone. I'd like to thank Chinny and MNQF for hosting this, and particularly on National Testing Day. I come from an HIV prevention community background. I worked for a community-based organization for over 20-something years, where I coordinated all of our HIV testing programs, the federal, state, on all levels, CDC, and we also launched the first mobile testing unit in our state. And so I come from a community-based approach. I am the health and wellness chair at the Trinity Baptist Church, which Trinity has been involved in HIV education and testing for many, many years. We were even funded through the South Carolina HIV/AIDS Council to do a faith-based program called Project Faith, which involved getting the community tested. So it's with that background that I joined this conversation, and have been blessed, because I've always said people who work in HIV must have a certain mindset where it wasn't just your work, it was really a ministry. And you have to have that type of empathy and attitude toward people to do HIV work. So thank you much for including me.
Awesome. Thank you so much. Ms. Stacy?
Hi, my name is Miss Stacy Jennings Singor, and I am a woman of lived experiences for almost 30 years. October 17th will be my second birthday. June 16th was my born day, and October 17th was my born again day because I had to learn to live a whole new life. It has been a journey, but it has been a humble journey along the way. And I'm just honored and grateful and thankful that you all have me on here today. Welcome and welcome, welcome to all. Thank you so much.
Thank you very much. Thank you. So we're going to do things a little different today. We're going to hear the lived experience testimony first. And then along the way during the conversation, we're going to have poll questions to make sure that we hear your input and hear what y'all are thinking about this conversation. Now, don't forget what Brendan said. You have something related to the conversation. You have questions, please drop in the Q&A box and we will be sure to get to it. So, like I said, Miss Stacy, we'll be starting with you. Tell us about this testimony. Share your personal HIV story with us. How did you happen to get tested, and how was it for you when you received your diagnosis? What inspired you to take the first step?
Well, at the age of 20, um, I was born, they say with a silver spoon in my mouth. Out of seven siblings, I was diagnosed with diabetes. And so my life had been long and hard, even growing up. When I turned 16, I got married. I moved from Union, South Carolina, which is a small, small, quaint town. Everybody knew everybody, and everybody was family. So I moved from there and I moved to Columbia, where I started working. At the time, I had a 3-year-old son whom I was trying to raise, and my life was threatened. And so I was sent home because this young man was there and he threatened my life. He says, "I'm going to kill you." And so they had to send me home. So I went home. And after being home for an hour is where my journey of HIV began, not even knowing. He brought a pizza to my house. He was the only delivery person there. And my mother asked me to bring pizza because I worked at a pizza joint. And I would bring pizza home every time I worked. And so he disguised his voice. He covered up the peephole. And I opened the door to get the pizza. And he grabbed me, threw the pizza on the floor, and he sodomized me in my mother's floor. And when he left, he said, "I told you I was going to kill you." Had no idea what he was talking about. And later on, I kept hearing about HIV, but wasn't quite sure because it was known as a gay white man's disease. I said, "No, I'm not worried about that." So every day I was paranoid. I would check my body and I would look for different things. And I worried myself to almost death. And so I was hospitalized. They could not find anything wrong. They checked my diabetes and everything was good. And then they came in and said, "We can't find anything. We can't find anything else. Do you mind if we do a HIV test?" And I was like, "Okay, what does that have to do with me? I'm okay. I'm fine." And they came back a couple of days later, and in walked in about 15 doctors. I immediately was distraught because I knew, I said, well, all these doctors are walking in here. It must be something wrong. And the doctor, she came up to me and she said, "I'm sorry, but you tested positive for HIV." That day changed my life forever. And I wasn't open to receiving that diagnosis because I said, "I have a son. How am I going to tell my family?" My son was only 3 years old, and I still was living with my mom. And I called my mother. She was the first person I called, and I said, "Mother, you need to come to the hospital." So she came to the hospital and she just embraced me, not really understanding what that meant. And her saying, "Are you going to die?" And so she asked the doctors the same thing. They couldn't answer her question. But that was the first thing in my mind, is that at the age of 20 and being diagnosed with HIV, that was a death sentence. That was the end of my life. But little did I know that I thought that that was the end of my life, was the beginning of a whole new experience that I had to learn to embrace in order to live, in order to grow, and in order to inspire others. Please pay attention to your surroundings. Please get tested. Please know your status. And I've been doing this, and I've been inspiring others and promoting others to do what they need to do to be okay for almost 30 years.
Awesome. Thank you so much for sharing that, Miss Stacy. Thank you. Thank you so much. All right. Dr. Han, I'm going to go to you. Can you tell us what HIV, she's talking about when she was 20? That's quite a while ago. Is it still the same
30
today?
years ago.
30 years ago, yes.
Mhm.
Is it still the same today? What people, are there specific people who are affected by HIV, age groups, communities? And then why is it important to get tested?
Absolutely. Thank you so much. And thank you just so much, Miss Stacy, for sharing your absolutely powerful story. And I'm happy to talk a little about some of the science behind the beautiful stories. Because the good news is HIV has changed so much in the last decade, 2 decades, and just that there's so much that's changed. But I'll start with kind of a general sense of the landscape of HIV epidemic and what it looks like. What you were asking, Shini. Right now, there are over 39 million people around the world living with HIV, and here in the US, there's about 1.2 million people living with HIV. But really, thanks to many great advances in antiretroviral medicines and new advances in HIV prevention, really the number of new HIV diagnoses has actually fallen about 12% in recent years. And so that's a really good news overall. But we still see some real striking disparities and some stalled progress in some areas. You were asking like who is affected by HIV the most and where do we see kind of the health inequities? And unfortunately, we know that HIV affects some communities more than others. There's some geographical regions that are considered hotspots, especially around the major cities like in San Francisco where I live, kind of on the East Coast and the West Coast, but then especially in the South, especially in areas where Medicaid expansion has not happened. So, which makes sense as these are areas that have additional barriers like fewer healthcare resources, less access to testing, and less access to medications. Another group, young people, especially in the age range of 13 to 34, represent over half of new HIV cases. Gay and bisexual men and transgender women of color face some of the highest rates of new diagnoses. And communities of color, including Black and Latina communities, continue to be disproportionately impacted. And when I say that, I think it's really important to acknowledge that when we talk about health disparities or inequities, especially impacting Black and other communities of color in the South, that we're really naming that it's not about individual blame or behaviors of certain groups. It's about our unjust systems, and that includes, structural racism, classism, underfunded healthcare, economic inequality, incarceration, all these different forms of injustice that really drive these conditions for HIV and other chronic illnesses. And I really believe that naming these injustices is the first step to really dismantling them. And then I'll say too that as an HIV doctor who cares for folks from all walks of life, like I was saying, I also want to emphasize that HIV can affect anyone, regardless of your gender identity, your sexual orientation, your age, or your race. The HIV virus doesn't discriminate, but people do, and our systems do. But with, the amazing news is with proper treatment, people living with HIV can live long, healthy lives, thriving lives like Miss Stacy, and can access highly effective treatment because HIV is very treatable. It's a chronic illness now, not unlike diabetes or high blood pressure, where if you take your medicines, you can live a long, normal, healthy life. And really, the first step is you have to know your status in order to do that. And that's what's the only way though to know your status is to get tested. And that's why we're here having this conversation today.
Yes, thank you so much. So I like what you said. I like how you framed it. HIV, knowing your status, even if you're HIV positive, that's no longer a death sentence, right? So that's something that may have made a huge difference when Miss Stacy got her first diagnosis. So thank you for reaffirming that. Now coming to you, Ms. Vivian, as an advocate for HIV, how do you see community-based organizations leading the way in expanding HIV testing access? Right? Is it something that folks are doing? Is it something that, what are you seeing?
HIV testing in community-based organizations
yes.
were well alive and thriving, because of certain now HHS changes and CDC changes, community-based organizations have to be more in providing services and replacing funding that they have lost. But historically, community-based organizations, like I said, it's changed. Now we're down to a 1-minute test where it doesn't take but a 1 minute to know your status. And like Stacy years ago in 1996, how I got involved was my sister was diagnosed with HIV.
Okay.
The stigma that she had to live with while she was in the fight for her life made me decide that either you're part of the problem or you're part of the solution. And I wanted to be part of the solution. And I really started out in this volunteer health department, which then later, look how God worked. It really became my life's work and passion. And it was at community-based level that I felt the best impact was being made, because there's stigma that was associated with going into a health department. Health departments, especially at that time and still do, they had STD clinics. So if you came in and you went into the STD clinic, the stigma of going in there had people afraid to go in. And so we started one of the first mobile HIV testing programs in our state. And so take it to, we would use geomapping, that means zip codes, communities by the virus, and we would go to those locations and provide testing. But we also had to destigmatize that. So you had when we first started, we tried to add other things in. When we do health fairs, we would refuse to be put in the back room in a separate, trying to remove stigma. If you're going to have HIV testing at your church, it should be routine. And if you're going to your healthcare provider, your HIV test should be routine. It should go in there with checking your blood pressure, your cholesterol, your diabetes, your HIV. It should roll off just like that. And so the church is in a position to make that happen. And it has this, and particularly in the Black church, if pastor didn't say it, is not so. So getting church leadership, the pastor, the mother of the church, people who may not, mother of church was 80-something years old, but people seeing her go and get tested. She said she hadn't been sexually active since her husband died 20 years ago, but just taking that leadership role of showing that I'm going to sit in this chair right out here in the middle of this room and I want to be tested. And pastors that take that stand.
Oh, man.
By example, a very intentional decision to visibly be in the community, not just when I went to do testing. I would go in the Black community for lunch. I'd go to the Hispanic community for lunch. I'd go to the restaurant. I'd go to the local convenience stores. I would buy my gas in the community. I would come out to community events, so that, because at one point there was a stigma attached to even talking to me. At one time I was the AIDS lady, then I was the condom lady, and so that would, and really in the church, one of the most hardest things were destigmatizing, talking about condoms and talking about barriers, because that's really all we had. And so, like I told you, my sister was diagnosed in 96. She died September 96. If she had lived months, that's when that's when the antiviral treatment came out. She was on AZT. That's all they had. And if she had just held on 6 more months, she might have been here, like with Stacy talking about 30 years later. And so the innovations in technology has changed so much. But we can go backwards, particularly if, like a lot of the research that went into the COVID vaccine was from people who had been working on an HIV vaccine.
Okay.
So
All right.
if we have people in this administration that are anti-vax with a vaccine for HIV, I'm afraid that it'll be these deniers, anti-vaxxers. So it's going to be even a harder push now because we're now fighting misinformation, which is as bad as no information. But the more routine you make the conversation, the more, until that pastor preaches that first
Yep.
HIV.
All right. Ms. Vivian,
Testings at the church.
thank you so much. Can you tell she's passionate about this? Thank you so much. And thank you for sharing about your sister. We're sorry for that she's not here with us today. Thank you. All right, so Ms. Vivian brought it up, and we're going to talk about stigma in a minute. But before we do that, I want Ashley, can you pull the first poll question? Let's see what folks are thinking about HIV testing today. So if you're at home, please, we want you to respond to this question. Which of the following is true about HIV testing today? HIV self-testing kits are available for at-home use. HIV tests are only available at clinics or hospitals. You need to fast before taking an HIV test, or I'm not sure. Oh, look at you all. I love it. Thank you. Okay. I'm going to give this one more second and then I'm going to end this. All right. So are you all seeing the results? Can someone let me know if you're seeing the results? All right, anyway, I have 60% saying that the results, that the test kits are available for at-home use, 20% saying that they're only available at hospitals, and 20% saying that they're not sure. So I'll let you speak to this result, Dr. Han.
Sure, yeah, it's very exciting that there's just so many easy ways to get tested these days. Nowadays, we're trying to normalize testing, right? The CDC guidelines actually recommend that we test everybody for HIV starting at the age of 13, actually, at least once. And now, there's so many places that you can get tested. You can ask your regular, routine primary care doctor when you go see them. There's always, all kinds of health fairs and otherwise. There's even, take home tests that you can order just to do in the privacy of your own home. There's also, we have these rapid tests now that are very accurate and they can actually give you a result in just a few minutes. As Vivian was talking about that. And those are really great for, health screenings that you're doing either at your church or out in the community health fairs. It's been really just super powerful because, like we said, the only way to know your HIV status is to get tested. And
Absolutely.
it's quick. And if your test is positive, you can, like we said, take medicine to treat HIV, to live a long, healthy life and protect others. If your test is negative, then you can take actions to prevent HIV and to remember to continue to get tested.
Absolutely. Thank you so much.
And also, if you're
Pretty
using the home test, the one caveat is surveillance is impacted by home testing, but also linkage to care. Because if you're going by the 90-90-90 and you're trying to get people virally suppressed, and they need to be linked, and usually newly diagnosed sometimes takes sometimes years before someone discloses or seek out care. So
absolutely. So thank you for saying that. You're jumping the gun, Miss Vivian, but thank you for saying that.
with home testing.
So the answer to that question, the correct answer to that question is it can be done at home or the doctor's office. For those of you who were not sure. So we'll come back to you, Miss Stacy. Tell us about your experience and with stigma, right? how has that impacted you from when you got diagnosed, especially in places of community spaces like churches? How was that for you when you first got tested? And what are you seeing today? And then what helped you personally push through it?
When I first got my diagnosis, when I was in the hospital, my mother was the first person I told. Well, I went to a church. It was predominantly all Black, and she told her friend, and her friend went back to my congregation, and she shared it with one person, and then it got around the whole entire church. I had just been diagnosed, so I was afraid. I was afraid to even step into the church building because everybody looked at me as if though I was an alien or a monster. And people were being told, watch out for her, don't be her friend because you know she got that thing. So it was hurtful for me. It was devastating. Um, but once I started doing the work and I started telling my story, I walked into the local housing authority. And the young lady, I was on the news, and it was one of the first events that Vivian had invited me to. And I shared a poem because I've been writing, I'm a spoken word artist, and I've been writing from the moment of my diagnosis up until now. I've been writing for over 30 years.
Mm.
And I shared my story on the local news. And the next day I was like, what have I done? But when I walked into the local housing authority, the lady gets up behind her desk and she comes and she says, you are so brave. And she hugs me. And that gave me all the hope in the world. I said, someone loves me. I said, this lady don't even know me. And she embraced me. So from that moment on, I started telling my story and I continued to do the work. I was inspired by the love that was shared. And because of everything that I experienced in the church, um, it caused me to just get the word out and continue to share my story. And I've been sharing my story ever since. But stigma hit home about 10 years ago. And I was told, you don't need to have any children. You need to cut everything out.
Mm.
Why would you want to do someone like that? And so a few months after that, I thought I was being poisoned because I just got out of a relationship. And so I went to the emergency room and took a bottle of juice that did not taste right, not knowing that the chemicals in my body were transforming because it was making space for a baby. And so when the doctor comes back, he said, no, you haven't been poisoned, but you're pregnant. I said, there's no way. I said, because I was just told that I could never have children. I should never have children again. And so that began a new journey for me. 8 months into my pregnancy, everything was good. I was going to the doctors, and I went to the doctors one day, and they noticed that my son, it was going to be a baby boy. They noticed that my son was not doing good. He was not moving, and they said that was signs of fetal distress. So instead of them sending me to the clinic where they knew about the HIV and they were treating me as a woman pregnant living with HIV, they said go to the hospital. So I went to the hospital and they said we're gonna monitor you. So they monitored me, but they knew my son was bleeding in utero, and they allowed my son to stay in me for 19 hours, knowing that he was losing blood. And when we asked what was going on, they said, we don't know. We may never find out. I can remember them taking the paddles that you put on someone to shock their heart, and they put it on my belly. And we begged them to deliver my son so that he can make it, so they can figure out what was going on. But when my son was delivered, he had a hemoglobin of 2, and they took him away. They did not say anything, did not tell me anything. Or they put in my records that my son was HIV positive or exposed to HIV. My son did not have HIV. I was undetectable at the time. And they cut, double tied, and burned my tubes. so that to make sure I would never have children again. And it was very devastating for me. And that was the most stigma I had ever, most traumatic stigma I had ever experienced in my entire life. And so when they took my son's life, um, a whole new journey. I had to learn to live again without my son, without him giving the chance and the opportunity to live and to be able to tell the story with me.
Oh my goodness. Thank you. That's a very powerful story. I'm so sorry you had to go through that. I'm so sorry, but thank you for sharing. Thank you so much for sharing this with us today. I'm going to come back to you, Dr. Han. Um, Hearing her story, would you say stigma is the biggest barrier to openly talking about HIV and encouraging people to get tested? And how can we fight the stigma? How can we combat stigma? What are ways that you've seen it show up with your patients, with families, and how have you helped them address this?
Thank you so much for that. Oh, I'm so sorry, Stacy. Unfortunately, your story really reflects, it very much is, you are not alone. And I have heard many similar experiences from a lot of the people in the families that I have cared for living with HIV. And I truly do believe that stigma is still the biggest barrier. And that's for all of us. I mean, I speak for as a medical professional. I know that stigma is way too common in our communities, but also in healthcare. You know, we used to say the biggest barrier is our, medical technology. Like, back in the day, we didn't have very accurate tests. We didn't have very good medicines. But all that has changed so dramatically, right? Today in 2025, medical technology is not actually the biggest obstacle we have, right? Most people are taking one pill once a day medicines, or every other month an injectable medicine, and they're able to live long, healthy lives. So really, we have all this very highly effective medical advances, and that's really not what's holding us back right now. We are it really, it could almost feel like easy to say, like, oh, these days that medicine is so easy, you just take one pill once a day. It's, less complicated than diabetes medicine or high blood pressure medicine in some cases, right? Why would we still be having this battle against HIV? And really, I think it's, if you really think about how much the incredible amount of stigma is attached to HIV, how easy is it to stay on your medicine when you are facing that stigma and that discrimination? And then you may have other things piled on top of that, unstable housing or food insecurity or other things, difficulty navigating the health system. And so, yeah, I want to really affirm and uplift your story, Ms. Stacy, just by saying, like, when we survey people living with HIV, really the vast majority of people have experienced community stigma and health facility stigma. So that's like really a call in for doctors and nurses and other healthcare providers, really, that we must do better. But also in our community spaces, how is stigma being dealt with in our schools and our churches? Because stigma thrives in silence, and stigma doesn't always look like a very overt, like, hateful statements. Sometimes it can look like just silence. Or sometimes it can be like a joke, or sometimes it can be like social media harassment or trolling. And we have a role to play in fighting stigma in every way. I just want to tell a quick example, just to really reaffirm and like uplift Miss Stacy's story, that the kind of pattern of stigma that I've seen caring for patients in and around pregnancy over the years is just so overwhelming. Like, I think people don't know that about half of people living with HIV actually really want to become parents, yet they're rarely asked about it. And that silence is a kind of stigma and a kind of dismissal that I know we need to do better about, right? Because that dismissal really says, your desires don't count. And I cannot tell you how many patients I've seen where I meet them for the first time and they have told me how they've always dreamt about having a family, but the reason that they hadn't is because they got the message from somewhere, either from a healthcare provider or from friends or family or somewhere that told them this message that they cannot safely have children, or that their children would be born unhealthy, or that they wouldn't live long enough to care for their children. And that absolutely infuriates me, because we know that's absolutely not true, and that stigma in this case has almost taken away the dreams of folks who do want to start families. And again, this is my field of work. For the past 10 years, really nothing brings me more joy in my work than being able to tell patients that you can absolutely build the family that you dreamed of safely. And I hope that really important information can get to everybody, because yeah, just I really, Miss Stacy, you are a testament to the fact that people living with HIV can live extremely healthy lives. They can live their best life. They can have joyful lives with HIV. And they can get married, they can raise children. Some are health professionals, some are leaders in their churches. And that, HIV doesn't look like one thing that affects one group of people. It looks like all of us. And I appreciate just your affirmation of that, and embodiment of that every day. Yeah.
Absolutely. Thank you so much, Dr. Han. Thank you very much for that. Well, for saying it that way. I appreciate you. Actually, I'd like to run the next two poll questions to see what folks are thinking about the biggest barrier. So our next question is, what's the biggest... Oh, we've answered this one. Will you be able to go to the next one? What is the biggest barrier? Want to know what people think is the biggest barrier for HIV testing in their community. I don't see if the poll is going on. I can't see it, but if it is, go ahead.
The answers are there.
Oh, so what are the answers? Dr. Han, do you mind reading out the answers?
Oh, sure. So the question, what do you think is the biggest barrier to HIV testing in your community? Stigma and fear, lack of access to testing sites, low awareness or misinformation, transportation or cost barriers, or other. And so far, the thing that is getting the most votes is stigma and fear. Also,
Okay.
low awareness or misinformation is a close second.
Misinformation, close second. Thank you all. And then the next question, please, Ashley, if you could run the next question. And I'm not sure why I don't see it. So Dr. Han, if you would take that as well.
Sure. So the next question is, do you believe faith-based spaces like churches can help reduce stigma around HIV? And the first response is yes, they play a vital role. And that one so far has the most votes. Maybe, but it depends on the leadership is the second, and that has 1 vote. And then no, stigma is too deeply rooted. No one has voted for that yet. And then I'm unsure. No one has voted for that one yet.
Okay. So we'll go with the one with the most answer, which is what?
Which is yes, faith-based spaces like churches play a vital role to reduce stigma around HIV. I agree.
So you guys are rocking it. You guys are rocking it. So that's a very good segue to my next question for you, Miss Stacy, which is from your experience as a person living with HIV, what are some ways that you see you can help, or you can ask churches, so to say, or recommend to churches, suggest to churches to help to reduce the stigma in their spaces, to encourage testing, to affirm people who are living with HIV? What are some things you would recommend?
Oh, so some things I would recommend is what I'm doing today is I'm telling my story. It is putting myself in position to educate. And I think a lot of times people don't get tested or unaware about testing because they're not educated. And a lot of people are being driven based off of stigma. If you find out your status, you're going to die. Or if you're diagnosed with HIV, you're going to die. Or you'll never be loved, and you'll never be able to experience life. Well, I am a living testament and living proof that there is life after an HIV diagnosis. Almost 30 years.
Wow. Thank you. So it's telling the stories, giving people comfortable spaces is what I hear.
Yes.
To tell their stories, encouraging testing, which we've said over and over again today.
Mhm.
And like Ms. Vivian said, if you're doing testing, don't put HIV testing in the back room. There's nothing to be ashamed of. Dr. Han, do you want to tell us about who should be tested? Because if we're saying it's nothing to be ashamed of, who should get tested? You mentioned that as long as people turn 13, they're encouraged to get tested. But other than that, who should get tested?
Yeah, absolutely. I mean, a very simple answer is that really everyone should get tested. Everyone over the age of 13 is what the CDC guidelines say. The amount of how often, so everybody over the age of 13 should have at least one test, or anyone who is sexually active. But how frequently to get tested, it really cannot hurt to just get tested anytime that the chance comes up. You happen to be at your primary care provider's office and it's time to get your diabetes check anyway. They're already drawing your blood, may as well get a test, right? You're out in your community and they're doing a health fair and they're offering HIV testing at your church or at your school, wherever, may as well get it, right? The more, basically anybody who is sexually active should be getting routine HIV screenings. And the more kind of behaviors that you do that put you at risk for HIV, it is recommended to get tested more often. So for the most people, that's maybe about annually. But of course, if there's more, you can always get tested more often than that, based on what behaviors you are doing.
Absolutely. And thank you for mentioning that. But I think we would be doing a disservice if we didn't talk about PEP and PrEP. So talk to us about PEP and PrEP. How does it impact testing? If I take PrEP, do I still need to get tested? If I've taken PEP afterwards, do I still need to get tested? Talk to us about PEP and PrEP.
Totally. Thank you so much. And first, I will say what PEP and PrEP is, because I know not everybody is necessarily knows about PEP and PrEP, but these are I would put among the most exciting new advances in the field of HIV in the last a decade or so. So PrEP is it stands for pre-exposure prophylaxis, and that is basically a very exciting tool. It's a pill, or now an injection also, taken by people who are HIV negative, that actually prevents HIV or protects them before any kind of HIV exposure. And it's actually over 99% effective when taken correctly. You can think of it as like a birth control pill, but for HIV. And so if it's a pill, it's the one pill once a day. For injections, they actually just this week approved a twice a year injection for PrEP, which is very exciting and is very kind of the most exciting news in a while about HIV prevention. And then PEP, that you mentioned, Chinny, PEP stands for post-exposure prophylaxis, and that's kind of like the morning after pill for HIV. So if someone thinks they may have been exposed to HIV, PEP can actually prevent infection if you take it within 72 hours after the exposure. And it's a 28-day medication. It works best the sooner it's taken. And so this is a great tool for emergency situations like a broken condom, a needle stick injury, something like that if you're a healthcare worker. But again, it only works if people know it exists and how to access it. So I'm so glad that we're talking about this now. And for either of these, you would always get an HIV test before starting. And we would recommend getting tested regularly while you're on it. If you're on PrEP, we would recommend continuing to get tested. If you are somebody who's taking post-exposure prophylaxis PEP for some exposure, there is also a recommended follow-up testing to make sure that we're monitoring.
Absolutely. Thank you so much. Coming back to you, Ms. Jennings, how can we continue to build on momentum for testing beyond national days like this? How can we routinize testing for HIV? What are some ideas that you have, especially in today's political climate where, things like this are not as, we're not talking about them as much as we should be. Funding for projects like this are going away. What are some ideas you have to keep this in the forefront of folks' minds?
So I think as a woman living with HIV, is to continue to show up. And as I said before, continue to educate. Education is the key to allowing people to live longer, happier, and healthier lives. And as long as we continue to show up and put ourselves in position to answer to every call, to continue to educate, to continue to support, continue to remind persons how important of testing is, then I think that would change the whole scope of a person getting tested. And just putting myself there and then showing them that there's still life, that I am still living, even being diagnosed for as long as I've been diagnosed. And if I had not had the education, if I had not had the awareness, then it probably would go a whole different way. And so I'm just urging persons to just show up, continue to take precaution, continue to allow yourselves in places and positions to do what needs to be done, and that is to get tested.
Absolutely. Thank you so much. Miss Vivian, we missed you.
I know,
Thank you
I
for
don't know what
hitting that
happened. My
button.
computer went down and I tried to get it up on my phone, but then I
No
need
worries.
the call ID number, which
No
was
worries, no worries. All right. So what we're talking about now is how do we keep the momentum for these conversations, the importance of getting tested beyond national days like this when we have these webinars or when we know it's a day for testing. How can we make sure that we recognize testing, HIV testing? What are some ideas that you have?
uh, um, is to continue to offer opportunities for testing in non-conventional settings,
Mm,
conversation going, but because of the medical advances,
mm,
where people no longer look like they're dying with HIV, they now have to learn how to live with HIV.
Mm,
People tend to think that it's like COVID. If you don't, you think COVID's gone away. It hasn't. And because people don't see the physical presence anymore, they think the HIV is gone or that it's no longer important. Like we could go back to some of the old lessons. Like in the old days, we knew every night on the nightly news where the quilt was.
yeah, yeah. Thank you so
and,
much.
and you only hear about HIV on World AIDS Day, National Testing Day. One thing when we were, before I retired at the agency, we knew that on National Testing Day, HIV, women's and girls, that the news media was going to show up at the office. I want
Yeah,
to take a picture filming someone getting tested. It has to be intentional,
yeah.
uh,
Thank you so much.
keeping it in the consciousness of people.
Absolutely. Thank you. Dr. Han, give us a medical perspective. How do we make sure we stay on top of this?
Totally. Thank you so much. I mean, I agree that spreading awareness is just so the most important, and normalizing that we're talking about this is so important. And like I said, I feel like I still, when I tell people about the advances that we've had in the last 10 years, people are still very surprised because we just don't have these conversations out in the open. And I think one thing that like we should be shouting from the rooftops is that really I just wanted to talk a little bit about the medications and like how like incredible the advances have been. But today, like I said, most people with HIV can live very healthy lives taking just one pill once a day or an injection every 2 months. And that's really like what modern HIV care looks like. It's simple, effective, and really powerful. And that really simply put, antiretroviral medication saves lives. And that one thing that a lot of people don't know is that when a person with HIV takes their medicine consistently, just that powerful medicine really stops HIV in its tracks. It really like reduces the amount of HIV to undetectable in the blood, and it keeps your immune system protected. And it does that so well that people with HIV these days have essentially the same life expectancy as HIV negative people and live the exact same lives and have normal sex lives and have, enjoyable families, all of these things. And that there's this very exciting concept called U equals U, or undetectable equals untransmittable. And what that means is if you take your medicine regularly, you can reach undetectable HIV viral load where the amount of virus in your blood is so low that we can't detect it on our blood test, right? When you come to me for my clinic visit and we're doing your blood test, we can't detect HIV in your blood. And when someone's HIV viral load is undetectable, that means they cannot pass the virus to their sexual partners. And really, it means zero risk if you're taking your medication. And that's just a scientific fact that has been extensively studied and means people with HIV can have normal sex lives. They can start families without fear. And I feel really lucky to be able to care for people who are building their dreams through family building, and just honored to have walked alongside many patients who, through their whole pregnancy and their delivery, and they've continued to seek care, their primary care with me, with their children, and their follow-up care. That's just been a very beautiful thing to get to witness, and just really want to the kind of pay homage and show appreciation for these, saying that these amazing advances like that HIV activists have fought for these last few decades have really inspired me to do the work that I'm doing today, and that these breakthroughs are the ones that we've dreamed of, and that we have to spread awareness about the fact that this is the reality now, and so much has changed.
Yeah, and when you add PrEP to the formulary with the U equals U, then we may get a handle stopping HIV.
Absolutely. We just talked about PrEP and PEP before we started talking about this. Thank you for emphasizing that, Ms. Vivian. Ashley, could you run the last two polls for us while our panelists are putting together their last, their closing statements? The last two questions in our poll.
Yep, they've already been answered.
Okay.
But maybe some attendees are unaware and they can still answer if they would like.
Okay, so the questions I'm asking at this time are: what's one action you're most likely to take after this webinar? Get tested or retested for HIV, talk to others in your community about HIV testing, share this information with your church or faith leaders, partner with a CBO health agency, and to learn more and get involved in local advocacy. Dr. Han, can you tell us the results of that? Do you see it?
Sure, I am scrolling to it. Oh, okay.
I'm not sure why one action,
yeah. Totally. So yeah, one action that you're most likely to take after this webinar. So the most people voted for talk to others in my community about HIV testing, but also get tested or retested for HIV, and sharing this information with my church or faith leaders.
Oh, great. Oh, great. And so the final question is, would you be interested in receiving resources to help bring HIV testing or education to your community or faith space? And what's the answer for that one?
The majority is saying yes, and also maybe, and needing more information.
Absolutely. So if you need more information, I'm going to be dropping the email address to send your questions to, or whatever information you need. Just let us know, and we will be responding. I know we're almost at time, so I'm going to go around the room and just ask everyone to give a closing statement for what action you want folks to take. Miss Stacy is going to give hers a little differently as a poet. She's put together something beautiful she wants to share with the group. So she will share hers as a poem, but I'll let you go, Dr. Han, then Miss Vivian, and then Miss Stacy.
Sure, thank you. I mean, yeah, this has been so powerful, and I always learn so much. And I just want to say that something, as far as fighting stigma, like a last word about that is something I'm really trying to push myself to do really intentionally, as in my role as a healthcare provider, is try to combat stigma by being intentional about the language and the words that I use to describe HIV. Because one really powerful tool we have to fight against stigma is language, and that language is so powerful, and it can be, you know, weaponized to disempower somebody, or it can be used to treat someone with dignity and respect that they deserve. And so, you know, one thing that it may seem small, but I really like to use people first language, meaning we say people living with HIV instead of HIV patient or HIV infected patient. I know, you know, this is not just for HIV, but for people with any health condition, like people who use drugs, or like, you know, people who have diabetes. Like I think it's really important to humanize it. And really it's a small change, but like the big message is, you know, you are human, you are worthy and respected, welcome here. And that we need to say this over and over again until it becomes a norm. And of course, there are many other ways to fight stigma by just normalizing discussions about HIV, normalizing testing, like we've all said, you know, make testing as routine as a flu shot or a blood pressure screen. You know, let's talk about it in our communities, in our churches. And I'll just say, like, my, you know, final, like, kind of call to action on National HIV Testing Day is, what I ask is, if you've never been tested, get tested. If it's been a while, get tested again. Encourage a friend to get tested, bring them with you. If you work in healthcare, like I speak to my colleagues, really make testing routine and normalized and stigma free. Right. We want it to be as easy to talk about and easy to access, and yeah, break the silence. If you're a part of any community, break the silence and talk about HIV without stigma.
Thank you so much, Dr. Han. Miss Vivian, 1 minute.
Picking back on her, I do believe, you know, silence is death, and you break the silence. And people, on one of the questions, what actions can you take? Of course, you can plan and schedule an HIV testing event at your faith organization, churches. Also, you can look in your community. They have now trainings for lay people as community outreach workers. And so if you have a functioning health ministry, that you get your folks trained as community outreach workers, where they can now go out into the community and tell people about events that your church are having. Looking forward to the future, I would say, you know, this is a call to action. And in the famous words now, in this boots on the ground, and where them church fans at, you know, so get those church fans out and let's get boots on the ground and start planning and making testing available for folks.
Thank you so much. And over to you now, Miss Stacy.
All right. Are you ready to take precaution? Are you ready to take a stand? Or are you ready to meet your maker to receive your reprimand? Are you ready to take precaution? Are you ready to take a stand? Or are you ready to meet your maker to receive your reprimand? Pay attention to your surroundings and keep an open mind, because there's something lurking and it carries a deadly sound. It does not discriminate when it comes to your age, when it comes to your color, when it comes to your race, and is seeking to devour as it meets you face to face. Children are being born yet to lose their own lives, causing so much pain, envy, grief, and strife. Men and women are dying daily because they have no other choice, because they fail to listen to the warning voice. Please protect yourself, because I do not care. And once I get a hold of you, your life will be full of despair. So stop contributing in the madness and distributing corrupt seed. And if you clearly hear me and if you clearly see, realize that I'm speaking of the disease known as HIV. So are you ready to take precaution? Are you ready to take a stand? Or are you ready to meet your maker to receive your reprimand? Please take precaution and get tested today.
Absolutely. I couldn't say it better. It's National HIV Testing Day. Go get tested today. Thank you so much for joining us. And thank you so much, my esteemed panelists, and to you too, Ashley, for all your support on this webinar today. We will be sending out a link for you all to rewatch, to share with your folks so they can also watch it. But remember, like Ms. Vivian said, or Dr. Han said, get someone with you when you go get tested, but get tested today. Have a wonderful weekend. Thank you.
Thank you.
Thank you.